Hello, I'm Dr. Hanume Gowda, consultant orthopedic surgeon practicing at AHA Orthocare, Nagarbhavi, Bengaluru, specialized in joint replacements and spine surgeries. Neck pain is a very common problem in the society. Almost every individual will have some sort of neck pain and would have taken treatment for a neck pain at some part of their lifetime, but everyone will suffer some sort of neck pain during their lifetime. It's become very common amongst the younger individual these days. Earlier it used to be, by and large, above 50 years of age people, that age group people would get neck pain, younger people would never get this. Now it's become more common among youngsters. Now the causes are very varied, but the most common problem or the most common cause is the posture. The way they sit while working or the way they sleep, sometimes sleeping on couches, sleeping on bed with a propped up position, watching television during sleeping, watching mobiles while sleeping and putting their head down like this completely while watching the mobile or small little handheld devices. These are the common causes which are affecting the younger age group. But otherwise generally neck pain is because by and large is because of posture. While you sit, you don't sit properly. Your body goes to one side like that or this, and you rotate your system like that while working, and all these things will lead to loading of one side of the muscles of the neck and the other side will become a little bit weaker. So that leads to that imbalance and pain will happen. Other causes of neck pain will be injuries which can happen due to a fall or while you're traveling, suddenly there is a brake applied by the driver and you just fall forwards and go back. These are the common causes, and there is also a situation where there are some infections that can happen in the neck. Then there are inflammatory disorders, that is autoimmune disorders that can affect the neck. And last of them is causes unknown. This is a big group of people where the cause is not known. Then there are other causes like slip disc. What happens in the low back can happen in the neck also. That can lead to a different type of neck pain. Then other neck pains are like a radiating pain from the shoulder going up to the neck or neck going down to the shoulder. All these things are sometimes even the heart pain can mimic like a neck pain and also mimic like a shoulder pain. So these all should be kept in mind. Then there are other metabolic disorders like uric acid problems which also can lead to neck pain. C5, C6 is the most mobile segment in the cervical spine, that is the neck. Here the injuries are more common. Injuries need not be a fall or any of that sort or a direct impact on the neck. It can be like repetitive injuries also, like bending down and lifting up and dropping your head while reading something or sitting in wrong postures. All these things will affect the neck bones, but C5-6 is the one which gets affected more. There is a disc between the C5 and C6 vertebra that can get slipped and that can go and press on the spinal cord and also the nerve roots around there. That can lead to some symptoms. The symptoms common are the neck pain and also radiating towards the shoulder, one of the shoulders. If the disc has come out more towards the right, you get a right shoulder or a right arm or a right thumb and index finger pain. If it's on the left side, similarly you can get those pains on the left side. This is the commonest thing. Very rarely you can get weakness and also numbness. So when the situation goes up to weakness and numbness, it has to be considered as a serious situation and you will have to really take care of it. Going to a doctor will definitely help. Exercises will definitely help in these pains, in the neck pain and C5-6 pains. If at all there is no radiating pain to the thumb and the fingers. If at all there is no weakness, if there is no numbness, then exercises will definitely help. Strengthening the back of the neck muscles and also the side of the neck muscle. The back is here and the sides are here. There is very specific exercises, there are multiple exercises that can be done. But important is, whenever you sit for work, every half an hour to 45 minutes, take a break and rotate your neck, look up, look down, turn to one side, turn to the other side. These are the simplest exercises you can do. Lift up your shoulder, take your shoulder back and front. These simple exercises will relieve the tension or the stress that is getting accumulated inside the muscles, and that can lead to avoiding getting the neck pain. Once you get the neck pain, you will have to continue the same exercises depending on the severity of the pain. If the pain is very severe, you will have to give it rest for some time, take some medications, painkillers. Once the pain comes down to a tolerable level, start the exercise again. If it is very, very severe, you will have to go and meet a doctor instead of doing exercises, because when the pain is severe, if you do exercises, it can actually aggravate the pain and lead to other problems. Tech neck, also called the screen neck. People watching screens on a regular basis for longer hours or prone to get these neck pains. The screens can be a large screen like a TV or even the computer screen, or the smaller screens like a tab or a mobile phone or anything handheld devices can lead to such pain. This happens because you are putting your head in one constant position for hours together because you are concentrated on work, you are not concentrating on your posture. Slowly what happens is when you are working with a mouse or something, the body balance will start tilting. As you start working with the mouse, the other hand goes away and you'll be starting working with only with the mouse on one side. So the other side will start getting weakened, or the tone is getting altered from right side to the left side. Then there are situations where the screen is a little bit lower than your requirement or higher than your requirement. So during these phases also your neck gets strained. Ideally the screens has to be at your eye level and at least about 40 centimeters from your eye. That is the ideal distance where you should keep your screen at your eye level. If at all your laptop is a little bit lower, you'll have to take it up, or you have to get down your chair level down. If you have a handheld devices, hold it as far as possible and hold it a little bit up on a stand or something so that you'll be able to watch it without straining your neck. And second thing that you can do is regularly move your neck every half an hour or 45 minutes. Just sit back, adjust your body, adjust your posture like that, and you know what, lift up your head, put down your head, turn to one side, turn to one side. All these movements, particularly when you're working, when you're doing these movements, don't do any jerks, don't do jerky movements like that. Do smooth movement. Jerky movements on already tired muscles can lead to spasm of the muscles and lead to more problems. So these are some few things that you can do. And if you want further studies on this, there's something called Anderson techniques of posture while working. You can just go through it. It's available on the net. Anderson techniques gives you exactly how you should sit, how you should stand. Everything is given there. It will definitely help. Neck pain and sleep are pretty much related. If you get a good night's sleep, neck pains are by and large controllable, or you can actually get away from neck pain. Once you get a neck pain, don't try to change too many things in your sleeping area. Don't try to change the pillow. You've been sleeping on such a pillow for about years together now, and suddenly because of neck pain you don't have to change your pillows. But important is when you go and stand against a wall like that, the head doesn't touch the wall, only the shoulders will touch. There's a gap between the head and the wall. The pillow has to be that thick if you're going to lie down straight like that. If you're going to lie down on the side, then stand to the wall, your shoulder will touch the wall, the head will be straight, there's a gap between, that is the thickness of pillow you need. Then the type of pillow is not really relevant. You can use whatever you are comfortable with. It should not be very, very hard, it should not be very soft also. Somewhere in between, a coir and fiber combination or a coir and cotton combination is supposed to be ideal, but not necessarily that it should be that way. Effectively, the type of pillow or the softness of the pillow or the designer pillows are not really required. If you can afford, you can use it, nothing wrong with it, but it's not a mandatory thing. It's about regular day-to-day activities and your postural corrections. Your activities on a day-to-day basis is going to really tell you whether you're going to get your regular neck pains or not, or else it's not really important what sort of pillow you use. The thing is, there has to be a little bit of, as I said, if you are going to lie down straight, a particular type of pillow. If you are going to lie down on the side, a particular type of pillow is required. Then there are other things that you can do once you get the neck pain. Some people prefer to use heating pads. Heating pads can be an electric heating pad, can be a hot water bag, can be towels put in hot water and rolled and put under the neck. These are all good in the initial phases, that is when the neck pain is not severe. But heating pads with electrical connections are a little bit dangerous. If you don't control the temperature, you can burn your skin. Skin around the face and the neck is a little bit softer and thinner compared to the rest of the body. So burns are very common in this area. You should be very careful while using heating pads where you don't control the heat. Rather, you very need to control the heat. If you put too much of heat, it can cause problems. Otherwise, heating pads are okay. If the pain is too severe, heating pads may not help you. You will have to meet a doctor. Neck pain is very common. The earlier you take care of it, the better. You get a neck pain today, don't postpone the treatment or taking care of it for a longer period. The first time you get a neck pain, there are a lot of over-the-counter medications for pain. As simple as paracetamol can be taken, or you can take some sort of muscle relaxant which are lighter. Don't take heavy muscle relaxants as a home care remedy. Please avoid taking heavier medications. Take simple medications. If at all the pain is not getting relieved, you will have to meet your doctor. Other than that, the care you can take is putting heat pads, giving a gentle massage with sprays, the pain relieving sprays, or an ointment or a balm or a gel. All these things can be done at home in the initial phases only. That is in the first 2-3 days. If the pain is crossing 3 days, that means there is something deeper happening. Don't wait for it to get relieved, or don't try too many home remedies. And the last thing that I want to say is that don't go for manipulation of the neck. It is a very dangerous thing unless it is being done by a really well qualified practitioner. Don't get a manipulation of the neck done. Better, like, people use it as a home remedy. Someone near the house, a neighborhood bone setter will do a manipulation, things like that can be done, but don't do it. It is going to be dangerous if things go wrong. Otherwise, simple care like taking small little medications, little bit of heat pad, little bit of massage by your family members. If it's not going to help with this, you will have to meet a doctor because there may be something more deeper.